This is a typical yang dominant and wind pain, complicated by either cold or heat. Treatment becomes complicated when the patient is on high doses of pain medications, such as carbamazepine. We have known patients who take 1,000 milligrams daily and go to work. Treatment is extremely successful, but the pain reappears each time the medication dose is reduced. Initially, dose reduction can be substantial, but we have to let the condition stabilize. Patients should be pain-free on the reduced dose before reducing again. The last 100 milligrams may or may not be possible to reduce. If it cannot be reduced, then it could be split into twice 50 milligrams per day. The first few treatments of acupuncture give the best effect if correctly given. We therefore try to reduce medication as early as possible so that the best treatments take effect when the medication cannot block the treatment. So general points, we use DO20 for tranquilization, GB39, influential point for the marrow, for the bone and nerve, GB20 with appropriate wind elimination needle technique, depending on cold or hot symptoms, mostly heat. Treatment according to the 3 divisions of the trigeminal nerve. First division, gallbladder meridian. Local points, gallbladder 14 through to mid-eyebrow. Then the extra point Taiyang through to triple warmer 23. With continuous frequency electrical stimulation, 10 Hertz for 20 minutes. So for the acute case, the yang is increased. So we sedate the gallbladder 38 or 36, vibrate triple warmer 6 when local needles are removed. The second tower diagrams is subacute or recurrent. We have the hyperactive yang. Sedate GB40, tonify liver 5, GB44, tonify yin, vibrate triple warmer 6 when local needles are removed. And the last one, the last tower diagram, the yin is decreased. GB24, front mu point, gallbladder 44, the metal point, liver 1, own element point, all will tonify the yin. Now, second division for the large intestine meridian, local points, stomach 3 through to LI20, stomach 7 through to SI18. With continuous frequency electrical stimulation, 10 Hertz for 20 minutes. The first tower diagram is acute, yang is increased, so we sedate LI2 or 7, vibrate stomach 44 after local needles are removed. The second tower diagram is subacute or recurrent, hyperactive yang, sedate LI4, tonify lung 7, LI5 to tonify the yin, vibrate stomach 44 when local needles are removed. Then we have decreased yin or yin deficiency. We have stomach 25, front mu point, LI5, fire point, lung 8, own element point, all will tonify the yin. As long as local needling is too painful, the same points can be used on the contralateral side without electrical stimulation. Third division, stomach meridian. Local points, stomach 5 through to REN 24. Stomach 7 through to SI18. With continuous frequency, electrical stimulation, 10 Hertz for 20 minutes. So the first tower diagram, excess yang, acute. Sedate stomach 45 or 34. Vibrate LI4 after local needles have been removed. So for the subacute or recurrent, hyperactive yang, sedate stomach 42, tonify spleen 4, vibrate LI4 after local needles are removed. Then we have yin deficiency, REN 12, the front mu point, stomach 43, wood point, spleen 3, own element point, all tonify the yin. Treatment is given twice weekly most of the time, increasing to thrice weekly when the medication is reduced by a large amount. When the pain is settled with the new reduced dose of medication, there can be a short interval of about a week before treatment commences again and medication is reduced. After having arrived at the point of no painkillers or as few as possible, treatment should be gradually withdrawn. We would continue as once fortnightly for 2 months and once a month for 3 months.